payments is also one of the key areas we are addressing in the current reforms. And in the new structure, we are looking at standardizing the fees, and this will be things that are publicly known, and also by enhancing our case management. The pre-authorizations will be standardized to ensure that there's no discrepancy, and these are actually embedded in the contracts that we'll be signing also with our providers, because by the end of September, we're going into our new cycle of contracts that will run from 2021 to 2024, and the reimbursement will be known and will ensure that also our members are aware of this, so that we are not in a situation where our members are forced to go out of pocket. In fact, it is good to also note that we do have what we call comprehensive contracts, and these are the contract A and B, that is for the public hospitals, some faith-based hospitals, and some private hospitals. And then we all have contract C, whereby it is only like for the rebates or certain packages that we reimburse. So in a category C hospital, then there might be extra charges that might be incurred. But for our comprehensive contracted hospitals, that is contract A and B, it is actually comprehensive, and patients should just walk in and be able to walk out after treatment without paying a single shilling.
Okay, so this will be captured in the new contracts that you'll be signing from September.
Exactly.
All right, let's bring out another video question.
NHIF is really good, but I wish they would change that condition where you choose the hospital to attend and make it just open, because when you are far away from the hospital of your choice, the process to connect in order to get the funds is a bit tedious. Na saa hiyo ukumbuke uko na uchungu.
What is the difference between those people who are covered, who are civil servants, and they are covered by NHIF? Because when you go to some private hospitals, they say they can only cover, there are services that they say they only for civil servants because of, I don't know, because of their job. Secondly, I'm contributing for NHIF. I'm deducted from my job or from my salary. But how is it that some of the services I'm not able to access, or some of the services are limited to me and yet I pay? What is the difference between me and a civil servant, and all of us are contributing towards that?
Daktari?
Yeah, and I will start with that last question. NHIF in essence has two main schemes. There's the national scheme, the one that you contribute 500 shillings per month, and it gives you the whole raft of benefits. Then we have other schemes that we call enhanced schemes, and these are our government-to-government schemes only, and that is where you find we have covers for the civil servants, the police, some county governments, the parastatals that opt to come to NHIF on a G2G scheme, that is government to government. And for that, they do pay an extra premium to be able to access that service. So that is what we'd call an enhanced scheme just for the civil servants or the national police or the county government. Now on the national scheme, it has benefits based on a national level. And that is the route or the tool that we're going to use to get to universal health coverage. And as I said earlier, for members, when they go to a comprehensively contracted hospital, which could be a public hospital or some private hospitals and some faith-based hospitals, they'll be able to get the care that they need without spending a shilling.
All right. Let's bring up another video question before I take in the call-ins. Also, if you're tweeting, use the hashtag Monday Report. It's easier to sift through like that. Let's bring up a video question or a call-in. Okay, let's get a question from video.
To know why NHIF can only cover a few percentage of money when a patient has gone to hospital, why can't it cover the whole of the amount? For example, a patient has been billed to have like 300,000, but you find that the NHIF only pays 25,000. Why that little amount of money?
Daktari, why don't you just cover the entire bill?
Sorry, Trevor, there was a lot of static. I did not hear the question well.
Yes, Daktari. The question is, why does NHIF only cover partial part of the bill and not the entire bill? And they gave an example of if the bill is 300,000, you find that NHIF will only cover 25,000.
Yeah, and that is a frequent question as well. And it is good to understand that in terms of our reimbursement, we do have those comprehensively covered hospitals. And in those comprehensive hospitals, the entire bill is covered. And why is it covered? Because we have already negotiated. For example, like surgery would cost and those comprehensively covered hospitals, the hospital is not to charge the member anything extra. But sometimes if a member goes to a hospital that does not have our package contract, or is not comprehensive, then you might find a scenario that they are billed for extra services. So you find that is where that the bed rebate would only be applicable and nothing else. But for many of the other hospitals, other packages, and this will be publicly known, as well as by the time of someone getting admitted, our care center or our case managers will be able to explain to the patient that this is what the coverage would be. And what we are working towards is ensuring that it is completely comprehensive in all the comprehensively contracted hospitals. So we will increase this knowledge, and also when you're billed extra when it's not expected, it would be great that you also inform us so that we get to know hospitals that are going also off the contract.
Okay, let's bring up another question.
This evening, I was in a health facility in Meru County, and I was sent for a full hemogram test, which cost 690 shillings, and I was told NHIF could not cover me. I had to off my money, and so I'm asking, what actually is the purpose of the cover if I contribute 1,390 every month, but the same cover cannot cover my bill, which is 690 shillings. Thank you.
Daktari.
Yeah, it would be good to know what hospital that was for outpatient, because for outpatient, as when we capitate, it means that your cover is comprehensive in that hospital for that period. So it would be good. I would like you to raise that issue with our customer experience center, and we'll be able to address to know exactly why you are billed for that extra investigation.
Daktari, do you have a fully fledged department that handles complaints from the people? For example, they call the person who just sent the video. Who do they go to? When you say reach out to us, who do they reach out to? Is there a number? How do they reach you?
Yes. Yes, we do. We do have even a toll-free number. We have a 24-hour customer experience center that takes calls. They also respond to emails. They respond to texts. They respond to even tweets or from members 24/7. And this is the group that is able to address those issues in real time. And then we also have another group of case managers who handle now the medical issues. They're the ones who do the pre-authorizations and do the letters of undertaking to ensure that the members get actually the services in real time. So we do have a 24-hour customer experience center.
Do you mind sharing the numbers?
Yes, we will share the number as we conclude the show, for you to be able. And it's also there at the back of every card.
Okay. Jeffrey here says, what plans does the fund have for employed people who contribute the maximum 1,700 per month and have other covers, yet when they get admitted, the fund only pays for the bed?
Yes, this, as we understand, for the statutory contributors or formal sector, they do contribute, and the contributions actually start from 150 shillings to the 1,700 for the people earning in excess of 1,700. And again, just to reiterate that when any of our members goes to a comprehensively contracted hospital, the cover is 100%. You actually walk in, you get the treatment, and you walk out without paying a single shilling. We have institutions or hospitals which are under what we call Contract C, and in these hospitals, if you get admitted, because they've not signed that contract for comprehensive hospital, our cover will pay and continue to pay for the inpatient rebate, that is per day, and for any packages if they've also been contracted for those packages. So like some of the higher end hospitals, you'd find that's where you'd get like the MRIs, the CT scans or the PET scans, that, and we contract them for those specific services. So if you do, or even a specialized treatment, so if you do go in for those particular treatments and they've been contracted for that, then that would also be paid.
Okay.
But the way we would approach it is to ensure that we get to comprehensively contracted hospitals, and then you'd be able to walk in and walk out without payment.
All right.
But for the other higher end hospitals, then it depends on the contracted packages.
All right. Erison here on Twitter says, I went to my outpatient hospital and I was told NHIF only covers Mara Moja and Piriton. How do I know what I'm covered for and what to pay for and not to pay for?
Yes, our covers are very comprehensive. For outpatient, it is comprehensive, and the hospitals that are on that list for capitation do and are required to provide comprehensive care for outpatient.
Okay.
For inpatient, also the comprehensively covered ones, they do cover, and we reimburse them appropriately for the services rendered.
Okay.
Yes.
Doc, hold that thought because we have a caller online, Mwajuma from Mombasa. Mwajuma, good evening.
Good evening to you.
Yes, go ahead, your comment or question, Mwajuma.
I wanted to ask, I've gone through this for a number of times. When I visit my healthcare provider, I am told that I'm not registered under that hospital, and it's the hospital that I go to every other time. I'm told that maybe like today this occurred. I was told that my son and myself are registered in Kwale, a hospital in Kwale.
And where do you live?
And I live in Likoni.
Okay.
So I wanted to ask, okay, I tried changing my healthcare provider to my previous one, and I was told that it would be effective as from October.
Okay.
Yeah.
Thanks, Mwajuma.
Yeah, what happened?
Okay. Let's get the response. Yes. Daktari, you've had Mwajuma's concern.
Yes. Yeah. So Mwajuma, every 3 months through our self-care platform on the mobile phone, you can be able to change the facility to a facility of your choice. And should you have any difficulty in being able to change, you can be able to visit any of our 156 service centers countrywide. And in the area of Mombasa, we do have our branch there, and you can be able to go there and get assisted to be able to change. But every 3 months on your mobile phone, you are able to change to the facility of your choice, and that reflects immediately. But I'll repeat, if you still have a challenge, you can call our customer care center or visit any of our 156 service points.
All right, we have another caller from Ukunda. Amani, good evening.
Good evening, Trevor. How are you?
Good, man. Go ahead with the comment or question.
Yes. I just want to ask Dr.
Yes.
That we know the deadline of payment of the NHIF is 9th.
Okay.
But before 9th, we are not able to be treated until they see that the money has reflected into the account. Is when they can start treating you. How is it that way?
Okay.
Yeah.
Thanks, Amani. Daktari?
Yeah, we try to ensure that our members are able to access services, and members encouraging them to also pay regularly, because one of the biggest challenges that we've been having is members, for example, paying, accessing a service, and then defaulting on the payment. So just like with any other insurance, you know that according to the law, it's actually supposed to be paid annually in advance. But we have made it easy for our members by breaking down that payment to the 500 shillings per month, so that it is easier on the pocket and to ensure that nobody at any point is not able to access healthcare. So we are working hard and would like that in this partnership, we help each other to ensure that the fund is also sustainable by paying regularly, so that the membership can remain active and you're able to access services without any challenges.
Yeah, speaking of payments, you were quoted in one of the dailies when you said that more than half the members stopped paying their monthly pays. So how many members do you have right now who are active, and what is NHIF going to do to bring them back, the ones who are defaulting?
Yes.
All right, we seem to be having a bit of a network challenge there with Daktari, but I see a lot of your questions coming through here.
That is a major strategy of coverage. Can you hear me now?
Yes, go ahead, Daktari.
Yes, great. And Trevor, that is one of the biggest challenges that we have, and one of the key areas that we're trying to address to ensure that we are able to get to universal health coverage, where everybody actually has that access. As you asked at close of the last financial year, the registered members on the platform were about 10.
All right. Seem to be having a bit of internet challenges there with Daktari, but I see a lot of your questions here also coming through. Alex Mulombi, Anwar. Daktari, you're back with us? Yes, go ahead. You're saying as at last year?
Yes. So only about half were active, and meaning that a lot of the members had come in, enjoyed the service, and then left. And this is what now creates a big challenge in terms of sustainability. So in the spirit of solidarity, whereby, you know, when you're well, you contribute, and then when you're unwell, those who have been contributing, the funds also help you. Because if you look at what you actually pay vis-a-vis the benefit that you get, that is quite large, and it will take even many years to even recover that. So we encourage that the members continuously pay, so that we are able to keep the fund sustainable, to sustain the benefits, and even be able to increase the benefits, and hopefully even be able to cover COVID as we move along.
Okay, we have another call online, Nachi from Nairobi. Nachi, good evening.
Yes, good evening, Trevor.
Yes, how are you doing?
I'm doing good.
Go ahead with a comment or question, sir.
My question to Daktari is,
yes.
He has talked about those people who are earning, maybe who are working in the private sector, and they are making a contribution of 1,700.
Yeah.
Now, most of us who are working in the private sector, we have covers from our employers.
Mm-hmm.
We hardly use the NHIF.
Yeah.
My question is, where does that money go?
Okay.
Why can't we see the NHIF even helping maybe the people who cannot afford health care? Then the money, why can't the money be used to help Kenyans who cannot afford medical bills.
Okay.
Secondly, Daktari has talked about, hospitals which are comprehensively covered. You see, the hospital that is comprehensively covered or individual, the contributor. And then how are we supposed to know that this hospital is comprehensively covered, the other one is not? Because it doesn't matter. What matters is the amount you contribute, and you expect to get help when maybe you are admitted. But the NHIF only ends up covering for bed one.
Okay.
Thank you.
Thanks, Nachi. Daktari?
Yes, thanks, Nachi. That's a very good observation as well. But just to assure you that NHIF works very well also with the private insurers. And like you mentioned, should you, God forbid, need to go to hospital, when you pay the bill, there's always a portion that NHIF pays, and that is either the bed rebate, and also for outpatient, should you choose a facility that is capitated, then even you who is also privately insured, NHIF would also meet those costs of the facility that you selected. So you see, this is what we actually mean by getting to universal health coverage, whereby everybody has the access to the healthcare that they need without that financial hardship. So for those who are in a position to be able to get also private insurance, it augments on the national health scheme. And we do encourage those who can afford to be able to get that. And that is where now you get that comprehensive cover as well in the contract C hospitals that I mentioned that would say that our reimbursement would not be, for example, enough for them. So that is how social health insurance works, whereby every player is important to ensure that all citizens are able to fit and ensure that everybody has that access. So NHIF does come into play even to those people who are privately insured, because even in the proposed bill, we will still continue to pay for the outpatient, continue to pay for the bed rebate, and continue to pay for the packages once if your private insurance, the limits get exhausted, we would still continue to pay after that. And that is what is proposed in the new NHIF amendment bill.
Yeah. Nachi also asked about the hospitals that are comprehensively covered and the ones that are not. How do they know?
Yes.
I mean, do you have a publication?
Yes, and the list of hospitals is actually put out in our website. You'll be able to access that. It's also possible through our customer experience center. Just make that toll-free call, and you'll be able to be informed in the area that you're in. And also, a lot of the hospitals actually do put their sign also outside to that it's NHIF. Comprehensive cover.
Yeah.
So that all those methods, but you can also be able to find out on that, and you'd also be able to download our app, my NHIF app, and you'll be able to interact and get to know which hospitals in your area are also comprehensively contracted.
Yeah. Doctor, do you believe that we are on the right track for UHC? Because you are the backbone of UHC. What will it take for NHIF to drive that to the end?
A few elements that are important. And number one is that all of us who can pay to be members of NHIF. And then those who cannot pay, that we identify them and support. And the government has taken the first step in ensuring that the indigents, those people who can barely afford the basic necessities of life, including healthcare, are supported by identifying the 20% of the 5.1 million households that countrywide have been identified as indigent to be able to be supported. And we hope that even us as Kenyans, we will take on that cue and adopt a family, adopt a village, adopt a slum, in terms of being able to lend a hand as well to ensure that every Kenyan does have cover. So that is the first key point, that everybody is covered. Then secondly is to also build capacity of our healthcare providers to make sure that this comprehensively covered the public hospitals, that our members can walk in and walk out without having to spend a single shilling. And all this will be enabled by the new the NHIF amendment bill. So we are looking forward to that bill being able to pass, so that we are ensured of covering all Kenyans and they don't suffer financial hardship, including just to make sure that even for those who can pay, because things happen sometimes and you default. In the amendment bill, we've reduced the penalties, which used to be fairly punitive, because we're talking about even up to 5 times or 2 times for the corporates, and that has been reduced to only 25% in the new amendment bill. So these elements that we're putting in place to ensure that we are able to get to one of the big 4 agendas for His Excellency the President, which is universal health coverage.
Yeah. Daktari, there's this question that people don't seem to be very happy with. This question around the civil servants and non-civil servants. You had explained the G2G arrangement, but just clarify that one more time. It doesn't mean then that even if you're not a civil servant, you can't access services, because there seems to be, from the comments, that there are some hospitals that are actually telling people that we only deal with civil servants.
So like I told you, the hospitals that have contract C, which is the non-comprehensive. Now, those hospitals, you'd find that they are the same ones that also private insurers would be accessing, etc. And for the category of the civil servants who have what we call an enhanced scheme, they have paid extra premium to be able to do that. So they've actually paid that extra premium as a government-to-government initiative to ensure that we support also the government employees to be able to access a more comprehensive. So it is almost akin to what would be they would have paid, let's say, in the private insurance. But this is specific for NHIF to government institutions to be able to support our government and one government initiative.
All right. Let's see if there's another question here. One final one before we go. Hezron Kabuge says, I took a patient who has a problem with hernia to Nairobi West and made an application to NHIF. We were told to wait for 1 week, only to be told NHIF rejected our application with no reason why, and yet she is a contributor and she still has that problem.
And in fact, Trevor, when we started, note that NHIF does not discriminate at all, and something like a hernia is covered, and we pay for so many of them among many other surgeries. It would be great to know whether the membership was active, because one of the key areas is that when somebody has not been paying or is a new member, there is a waiting period of up to 60 days. This is to cure the issue of adverse selection and people only paying when they have a need. And this is one of the ways to be able to protect the fund. But for that member who was asked that question, I would like them to get in touch with us and we find out exactly what the issue is, because we are there to support each and every Kenyan comprehensively as we get as universal health coverage.
Grace Story Teach is wondering whether NHIF card covers a cancer patient.
Yes, indeed. And this is one of the main packages that we have. And the cover for cancer patients is very comprehensive, because it even has from the first line treatment and even to advanced treatment, where it goes up to a reimbursement of up to 600,000 for the oncology package. But please note also that with the patients who happen to have cancer, there is the issue of investigation. So we are talking about the x-rays, we are talking about the MRIs, we're talking about the PET scans, which are also covered in a separate package. We also have, should they need surgery, because many times we know patients with cancer might need surgery, to be bowed, to remove the tumor, etc. That is also covered. under our surgical package. So our package to deal with cancer is actually very, very comprehensive to be able to manage the patients.
All right. CEO, what would you want your legacy to be after all this? Because I see there's very little complaints about just the efficiency of the system, really. It's just more like communication, because all the questions I get here is, how do we know those hospitals the CEO is talking about? If I raise a question, it is not answered on time. How are you going to ensure that this wheel of NHIF turns more smoothly?
Yes. Yeah, the legacy is, number one, to ensure that we restore the trust in the people, and to ensure that we deliver on our promise, and not just delivering, actually delivering value. And that is what we want to do as we get to UHC. So at the end of it, we want every Kenyan to actually have access to the care that they need without financial hardship. And NHIF is a vehicle that government is using to ensure that we get to that state. So the other thing is to also listen, and that is very key for us, that we listen to our members, we listen to their needs. And that is how NHIF has been progressing over the years, from when we were very basic on rebates only, to now very comprehensive covers, and now to ensuring that we even move into more digitization to be able to be responsive to our members. So, and then finally, to ensure that we're able to deliver on one of the big four agenda, and that is to ensure that we have UHC by the year 2022.
All right, Daktari, thank you so much for making time. Dr. Peter Kamunyu is the CEO NHIF. I'm sure we'll have you again at some point to continue this discussion. There are many questions that wasn't answered, but we'll get time for more conversations on this as time goes by. All right, that's where we leave it for now. My name is Trevor Mbija. Always a pleasure having you with us. On behalf of the entire team that made this possible, we say good night, have a blessed week ahead, and take care of yourself. All right, bye for now.